Hi everyone, this is Monica Moore, nurse practitioner and health coach at RMA of Connecticut. Today we're going to talk about an interesting topic, a question that I get asked a lot, and it's why we weigh you, why we put you on a scale when you come in for a visit. Weight is basically one of the vital signs that we do. So along with blood pressure and heart rate, it's really important for us to have this particular data point in order to decide what protocol to give you, decide how much medications you need. But we realize that getting on a scale is triggering for a lot of people who struggle with their weight or have struggled with the weight in the past, which I would argue is about probably most women, if not half of women. So we realize that this is triggering for you. It is important for us to get this information in order for a couple of reasons. One is because either extreme in weight, so very, very low BMI, or one of the higher BMI categories, and we all agree that BMI is not a perfect measurement, sort of just one of the metrics that we have, can affect reproductive outcomes. We know that it can make it more likely that you don't ovulate. Should we need to give you ovulation induction medications, you might require more of these medications should you be in either of these extremes. And if you're in one of the higher BMI categories, it can mean that you have other reproductive consequences as well, not just in terms of getting pregnant, but in terms of while you're pregnant, there might be some other concerns. So for one thing, it's important for us to know this so that we can fully counsel you about what your fertility outcome might be. The other reason is that the hope for us is that we are able to help you achieve a healthy pregnancy. And one of the times that people, or life stages that people gain weight pretty quickly, as they should, is during pregnancy. So if we have an opportunity to capture you at this time, and we have an opportunity to teach you some methods of healthy eating, of healthy lifestyle stuff, talk to you about sleep, talk to you about all these other lifestyle changes that might optimize your pre-pregnancy and therefore pregnancy journey, then we're pretty lucky, and we want to be able to take advantage of that. So we have mental health professionals. A lot of, as we know, what we eat has to do with behavior, or how we eat, why we eat, I guess I should say, has to do with behavior. We have nutritionists that can talk really about what we eat. And importantly, nutritionists that have an endocrinology background that can talk about the hormonal influence of what and how we eat, which is really important. And there's a very strong correlation between some hormones like insulin and leptin and hunger and satiety or satiety signals. And then we have health coaches like me and some other people that can help combine both of these aspects, behavioral and what to eat, with support, accountability, taking into account the journey that you're going through, coping mechanisms. A lot of us use food to solve a problem that food doesn't solve, and that's very common. But in order to not do that, we have to identify other coping mechanisms. So we want to put this out there because we really want you to understand that we completely acknowledge that getting on the scale can be very stressful. But we also want you to know that the reason that we're using this information is just to further your treatment with us. It's not to judge you in any way. We feel really strongly about not having any kind of weight bias at RMA of Connecticut. We understand what that is. We understand in the past, people may have felt that way when they saw a healthcare professional, which is so upsetting and disappointing. But we do need this little bit of information in order to help guide you, not only with your treatment plan, but in order to achieve the healthiest pregnancy possible. So thanks so much for listening. As always, please feel free to comment. We know that this is an emotionally charged topic for some, so feel free to reach out to us and let us know what information you would like about this topic or others. Thanks so much.